brain and your spinal cord, protected by your spinal column. But that's how important your spine is. That's how important getting adjusted is. That's how big of a deal spinal pain is and what it can do to you, as opposed to having some knee pain or some elbow pain or some shoulder pain or some foot pain. Not to dismiss those pains, they're real, but your spinal cord doesn't live at those levels. If you break your arm, you do not become a quadriplegic. If you break your neck, you absolutely can. So those are the kinds of issues that we have to understand when we're dealing with discogenic related pain in our neck and our back. We're talking about the difference between not being able to use the bathroom comfortably or not being able to use the bathroom on your own.